Hi guys, welcome to Medverse and welcome to another Jhukega series video where we talk about important topics of Neet PG 2022 and important PYQs, important questions. So in the previous video regarding Neet PG questions, important topics, Dr. Kalyan Das talked about the vascular surgery important topics and important PYQs. In today's video, we will talk about another such topic, which is food poisoning. This topic also we think like this is an easy topic and we can answer all the questions. But what happened in Neet PG 2021 this year Neet PG that a simple question came and a single word changed the answer of the question. So many people marked it wrong. So such things can be avoided if we read between the lines. And so in this video, I will give you a chart where we will in simple keywords we will try to find out the answer of food poisoning questions. So let's see. So for guys who are seeing our video for the first time, I am Dr. Jyotima Maji and I have done my MBBS from Bankura Shamilani Medical College, West Bengal, and I have secured All India rank 3296 in Neet PG 2021. So let's start our video. So so this is a very important question that few friends had dinner at a restaurant with they took pastry at late night, and the next morning they had vomiting. All of them had vomiting. So causative organism options are verocytotoxin and emitting toxin of Bacillus cereus, Staphylococcus aureus, and none of the above. So this is a very important question because in this line you have the answer. In this particular few words you have the answer. So they had pastry at late night and they had this episode of vomiting next morning, which is a food poisoning symptom. Vomiting, diarrhea, abdominal pain, all sorts of things are food poisoning symptoms. So the important information here is pastry. So they took pastry, that is a milk item. So that information will come. It will be useful. And the time period you see late night to next morning. So this is the time period within which the pathogenesis occurred, and this is we can expect this is nearly 6 to 8 hours. So with that in mind, we will see in the next chart what is the answer. Next question is few friends had dinner at a restaurant with same question, but this time they had fried rice and the same time period late night to next morning, and they had same vomiting. So same options. So what is the answer here? And the next question is patient in OPD came in OPD with fever, chills, headache, nausea, vomiting, history of drinking raw milk. So this is important information. Without boiling every day, and he is diagnosed as acute fever. So what is the most likely cause of the fever? Bartonella quintana, Staphylococcus aureus, Coxiella burnetii, and Campylobacter. Okay. So let's see how we can decode this in a simple chart. So we have to divide it into two parts. One is less than 6 hours time, one is less than 6 hours time, another is more than 6 hours time. Less episodes are occurring within 6 hours after intake of food, and the food item if is milk items, then mainly pastries in the question we saw pastry, maybe milk or mayonnaise, something like that. The answer is Staphylococcus aureus. You have to close your eyes and you have to mark Staphylococcus aureus because within 6 hours. Now the second option, thing is within 6 hours, and this time the patient takes fried rice or something like cereals. So in this case, the bacteria involved is Bacillus cereus, and the toxin usually involved is emetin, and in these cases diarrhea etc doesn't happen, usually only vomiting. So that is Bacillus cereus. So when food item is within 6 hour period, when food item is milk, then the answer is Staphylococcus aureus. When food item is cereals or fried rice especially, then the answer is Bacillus cereus. Then again the same time period less than 6 hours, the patient takes canned food, then the answer is Clostridium botulinum because botulinum toxin forms and such things happen. Okay, food poisoning symptoms happen. Now we will go to more than 6 hours differential diagnosis. So if more than 6 hours, patient having mainly abdominal pain, diarrhea, and patient has taken same thing, cereals or fried rice etc, then the answer is simply Bacillus cereus. And now emitting toxin is not acting, singly another toxin is also there. Okay, now if more than 6 hours to up to 16 hours, Bacillus cereus is limited. Now more than 16 hours, the cases can be divided into watery diarrhea if the patient is having watery diarrhea, and if the patient has taken shellfish, this is very important information, then most probably the patient has been infected with Vibrio cholerae. Okay, we know Vibrio cholerae causes watery diarrhea. Now, if the patient develops symptom of dysentery, bloody diarrhea, pain, abdominal pain, etc., and if the patient have eaten mollusks or crustaceans such seafoods, etc., things or something like that, then the answer is Vibrio parahemolyticus, and here there will be bloody stool or dysentery. Now, if the patient has taken raw vegetables or salads, then Shigella is the cause. So, if seafood, then Vibrio parahemolyticus. If vegetables, salads, etc., Shigella is the answer. So now we will go back to the question and decode it. This time patient taken pastry, so it is a milk item, and this time period most probably looks like it is within 6 to 8 hours like that. So the answer is most probably Staphylococcus aureus. Okay. And if the patient, in the second question, if the patient has taken fried rice, rice items, cereals, etc., and same time period vomiting is occurring, then emetic toxin or Bacillus cereus is the perfect answer. Now, if the same if another scenario where patient having fever, chills, headache, nausea, vomiting, etc., and patient is drinking raw milk without boiling every day, if it is mentioned every day, then and diagnosed as Q fever, if it is said, then the most likely cause of the fever will be Coxiella burnetii. So this is an additional information. So please you can take a screenshot of this of this chart and try to attach it in your notes or your book. So thanks for the day, and don't forget to like, share and subscribe our channel.